Dear students, welcome back. In the previous session, we have seen the functions of the wrist complex. In that, we have discussed about the movements of radiocarpal and midcarpal joints. Now, in this session, we are going to see the wrist instability. Okay, what are the causes which leads to a wrist instability? Okay, so injury to one or more of the ligaments attached to the scaphoid and lunate. So keep it in mind, if injury to one or more of the ligaments attached to scaphoid and the lunate may diminish or remove the synergistic stabilization of the lunate and scaphoid. So what happens now? So these two bones are attached with some ligaments. If there is any injury to this ligaments, one or more than two ligaments which are attached to these bones are affected, which causes mainly the scaphoid to be an unstable segment. So in the proximal row, the scaphoid becomes the unstable segment. So we have discussed about this intercalated segment, isn't it? So in some studies, they have mentioned that if the ligaments are not giving proper stabilization to these bones, there is a natural tendency to collapse of scaphoid into flexion, whereas the lunate and triquetrum will go into extension. These are called counter rotations which are taking place in the proximal row if the ligaments are not giving a proper support to these proximal row. Okay, so the same thing is also going to occur here. What is happening now? So because of the some disturbances or injury to these ligaments, which causes scaphoid as an unstable segment, and it is having a natural tendency to collapse into flexion. So if you can see here, this one is a dorsal intercalated segmental instability, but you can observe the scaphoid is going to flex. The scaphoid is going to flex olarly on the inclined surface of the distal radius. So this is the distal radius on the inclined surface of the distal radius. Okay. Here, the base of the flexed scaphoid slides dorsally on the radius and subluxes. So if you can see, so the entire thing of the scaphoid should be in contact, but here it is not in contact. Only some part of this scaphoid on the base is getting attached with this radius, and this part, that is the proximal part, that is the base of this scaphoid, is going to slide dorsally and it is in subluxation. So the base of the flexed scaphoid slides dorsally on the radius and subluxes. Okay, so then what happened? So then the next step after this thing, the lunate and triquetrum together acts as an unstable segment. So the next thing what happens means, if the scaphoid is going to be in flexion, so one of the bone of the proximal row is become unstable. The remaining two bones combined together form an unstable segment, because those two bones will have some ligamentous or interosseous ligament attachments will be there. Okay, so now the scaphoid becomes unconstrained segment or unstable segment. Then the lunate and triquetrum together act as an unstable segment, following their natural tendency. So how they will move? They are going to extend. Okay. The muscular forces that bypass the proximal carpels and apply force to the distal carpels. So once such kind of thing happen on the proximal row, so the muscular forces which are coming or which are crossing or which are bypassing the proximal carpels will apply force to the distal carpels, causing the distal carpels to flex. So the distal carpel is going to flex. Okay. On which the distal carpels are going to flex on the extended lunate and triquetrum. They are going to flex on the extended lunate and triquetrum. Okay. So the flexed distal carpels glide dorsally on the lunate and triquetrum, causes the extension of the lunate and triquetrum. This zigzag pattern of these three segments is known as intercalated segmental instability. Okay, the flexed distal carpels glide dorsally on the lunate and triquetrum, which are in extension in position, which causes zigzag pattern of these three segments, that is scaphoid, lunate, triquetrum and distal carpal row. That means scaphoid. So scaphoid is going to flex like this, and then lunate and triquetrum are going to extend like this, and again the distal carpal row is going to flex. How the appearance is? It is having an zigzag appearance, and this condition is called as intercalated segmental instability. So we are not discussing about any dorsal or volar. Such kind of condition is called as intercalated segmental instability. Okay. So it is of two types. One is dorsal intercalated instability and volar intercalated segmental instability. So when it is called as dorsal intercalated segmental instability and when it is called as volar intercalated segmental instability. Okay. So this is the scaphoid, and this portion, this yellow portion is the lunate bone, and this one is the distal carpal row. So when the lunate assumes an extended posture, so here the lunate is in extension, then such kind of presentation of instability is called as dorsal intercalated segmental instability. Okay. So in this, the scaphoid subluxation may be dynamic or static. Okay. So the scaphoid subluxation may be dynamic, occurring only with compressive loading of the wrist with muscle forces. If the muscle forces which is causing compression, then the subluxation becomes dynamic. Okay. Or the subluxation of the scaphoid may be fixed or static. Okay, with the subluxation of the scaphoid, the contact pressures between the radius and the scaphoid is going to increase because the contact occurs over a smaller area. So here only the smaller area is in contact. So because of this smaller area, the contact pressure between the radius and scaphoid is going to increase. The pressure is not going to change, but the contact surfaces between these two things are very small and the pressure is more. Okay, so there is no distribution of this pressure equally on the bone. So definitely here the pressures between the radius and scaphoid is increased. Okay, so in this dorsal intercalated segmental instability results over time, after some time, may lead to degenerative changes in the radioscaphoid joint and then ultimately at the other intercarpal joints. Okay, so this is about the dorsal intercalated segmental instability. Okay, so in this X-ray you can find that there is an dorsal tilt of the lunate, you can see here. So this is the dorsal tilt. So this is the dorsal aspect and this is the Olar aspect in this thing. This is Olar and this one is dorsal. So there is a tilt of lunate and here the capitate is going to flex. So which is present in distal carpal row, which is seen in the Olar aspect. So this is also an X-ray of dorsal intercalated segmental instability. Now we will move on to the volar intercalated segmental instability. Yes, this one is the volar intercalated segment instability. In this condition, what will happen here? So when the ligamentous union of the lunate and triquetrum is disrupted through injury. So here what is happening? So normally in the dorsal kind of instability, the ligaments between the scaphoid and lunate are damaged. But in this volar intercalated segment, what is going to happen here is some of the ligaments between the lunate and the triquetrum is also damaged. So then what happened here? The lunate and triquetrum together normally tend to move toward extension and offset the tendency of the scaphoid to flex. That function is going to last now. Okay, when the lunate is no longer linked with the triquetrum, then what happens? The lunate and scaphoid together fall into flexion. So now what happens? The scaphoid is also in flexion as well as the lunate is also in flexion. Okay, so both will fall into flexion. And the triquetrum and the distal carpal row extend now, and the triquetrum and the distal carpal row is going to extend. So this ulnar perilunate instability is known as volar intercalated segmental instability. So that means in this condition the lunate is also going to flex volarly along with the scaphoid. So such condition is called as volar intercalated segment instability. Okay, this condition is not as common as dorsal intercalated segmental instability. The problems of volar intercalated segmental instability and dorsal intercalated segmental instability illustrate the importance of the proximal carpal row stabilization to wrist function. So these problems which helps to understand the importance of the proximal carpal row stabilization to wrist function, and also the maintenance of the scaphoid as the bridge between the distal carpal row and the other bones of the proximal carpal row. So this is about the dorsal and volar intercalated segment instability. So another injury called as scapholunate ligament injury in specific. So this is also one type of dorsal intercalated segment instability. Here you can see this. So what will happen in the case of such kind of scapholunate ligament injury which leads to scapholunate advanced collapse? What will happen in this condition means, so the progressive degeneration, okay, so that means if the dorsal intercalated segmental instability problem is going to be progressed, that means with sufficient ligamentous laxity, the capitate may subluxate dorsally of the extended lunate, or more commonly this will migrate into the gap between the flexed scaphoid and the extended lunate. If it is untreated, so the dorsal intercalated segmental instability is untreated properly, so it is going to lead the scapholunate advanced collapse. So what is happening here? The progressive stages have been identified radiographically on the basis of the time lapse from injury. So it may take some years also. Okay. So whether the load between the scaphoid and the lunate increases or decreases with dorsal intercalated segmental instability, there is an agreement that the radiolunate articulation is less likely to show degenerative changes than in the radioscaphoid joint, and the lesser tendency towards the degenerative changes in the radioulnate joint has been attributed to more spherical configuration of the radiolunate facet, that better center applied loads across the articular surfaces. So these are all the studies about this thing. So what is happening exactly in the scapholunate advanced collapse means, so for example, if we take a case, a person who fall on an outstretched hand, that results in pain and swelling on the dorsum of the wrist, and a radiography is taken which shows there is a separation between the scaphoid and the lunate. Okay, so this shows that there is an ligamentous damage, including a tear of the scapholunate interosseous ligament, and the specialist suggested him for immobilization. Okay, and he also appreciated that there is an dorsal intercalated segmental instability. Okay, so after immobilization, the problem appeared to resolve with time. So again, the person after 5 years later, this patient having some pain at the same point. So, and the hand surgeon diagnosed the scaffold unit advanced collapse have been occurred. So what happened here? Because of repetitive loading of the wrist caused degenerative bony changes in the wrist complex, wrist instability marked by proximal migration of the capitate. So normally because of the scaffold unit ligament injury, the space between these two bones are increased. So because of repetitive loading, what is happening? This capitate bone is subluxed proximally into the gap. So here, so the capitate is going to occupy this space. Okay, and which is also causing pain. Okay, so this is called as scaffold unit advance collapse. Okay, so that is the proximal migration of the capitate into the space between the scaphoid and lunate, and degenerative changes in the radioscaphoid and capitate joints are observed. Okay, so then in this case the surgeon go for an procedure called as scaphocapitate orthodesis. So that means fusion of scaphoid and capitate is done. So because of this fusion, the capitate will not subluxate proximally into this space. Okay, and this was recommended to improve the stability. So stability means there is no movement of this capitate into this space, and it is such kind of procedure helps in the stability of this structure and allowing limited wrist mobility to minimize loss of function. So the movement may be limited but without loss of function. That means the person can able to do all his daily activities. So this is about the scaffold unit advance collapse. So all these things are related to the wrist instability. In the next session, we are going to see the muscles of the wrist complex. Thank you.